Oh my God. Hi, YouTube.
Wow, the first time we're going live on YouTube answering PCOS questions. Thank you for joining us, everyone.
Yes.
If you're here, we're just getting started. We're just going to start up our other lives too. If you're new to us, we're also on Instagram, PCOS.weightloss. We go live there like almost every day. So find us there if you need daily tips on PCOS. Let's go live here. Okay.
Sister.
All right.
We're live on Facebook. Kind of.
Okay. Yeah.
Are we?
Yeah, it looks like we're live. Sometimes it lags. I'm going to start it here. Alrighty.
Oh, nice.
3, 2. What's up,
sisters?
Happy PCOS Awareness Month. If you don't know, it's September 1st, meaning it is now officially PCOS Awareness Month. It's time to,
Time to do giveaways.
Yeah, time to do giveaways.
Give some free stuff and get our sisters excited about PCOS.
Yeah, but not to mention, like, it's the first day of PCOS Awareness Month, so we want to really spread awareness about PCOS, knowledge, start educating more and more people. That's why today we started with our first giveaway of the month. If you don't know, we're going to do a giveaway every single day of the month for PCOS Awareness Month. And starting today, we're going to start off the month with 3 giveaways. So we're going to give away 2 copies of Dr. Jolene Brighton's book, Beyond the Pill, and we're going to give away 1 3-month supply of Ovacital. All you got to do is go to Instagram, and on Instagram, our latest post, it kind of gives you the details on how to apply. So you just have to comment on that post, and you can basically be in line to win.
Get excited, sisters. Last night we announced one of the giveaway winners from last week.
Mm-hmm.
It was pretty entertaining.
Yeah.
And hopefully all of our announcements will be as entertaining every single night this week.
Oh, it will be.
This month.
Oh, it will be. And we'll be announcing winners every day at 5 p.m. Pacific Standard Time. So make sure you're following us on Instagram. I mean, if you're listening, you are. But make sure you keep on following us so that we always announce the winner perfectly.
This is pretty interesting. We're live on Facebook, on YouTube, on TikTok, and Instagram all at the same time.
Yeah.
And I feel like we've hit a 4th wall.
Oh, yeah. I mean, there's like 5 walls now. But Layla on YouTube says, I just started Ovacital today. Awesome.
How exciting.
Let us know how it goes, Layla.
If you haven't tried Ovacital, it's the link is in my highlight called Ovacital. There's a 15% off code. You have to put in the PRC box, not the discount code box.
True.
And it's just great for insulin resistance. We just recorded a podcast about insulin resistance, and it's actually dropping next week.
Yeah. So someone says, it's 2 a.m. here in Singapore, but I'm here for you guys. Oh, thank you. So
nice.
We're going to repost this live basically everywhere. So if you're watching now, you want to watch it later, we'll repost this live so you can watch this whole thing from start to finish, be able to forward, fast forward, all that kind of stuff.
I see a comment. My doctor said I have a lump or cyst in my ovary. Is that PCOS? To be diagnosed, you need 2 out of the 3. One is irregular periods. The other one is hyperandrogenism, and the other one is ovarian cysts. So if you have 2 out of the 3, you can be diagnosed with PCOS.
Yes. Someone asked on TikTok, how long should we work out per day? I mean, there's definitely no like set time for working out, but what I like to promote, like with me and Tallene, with PCOS, is about 30 to 45 minutes of like slow weight training per your workout session. And really that's about it. And that's like a really good workout, and you'll be able to burn calories and get that full workout in, and then rest the next day and work out the day after. So I like to go like Monday, Wednesday, Friday, and then Saturday if you're down for that. And that way with those rest days in between, you have enough time to recover for the next workout.
Did you watch our workout yesterday? We posted it on stories.
Yeah.
I thought it was pretty entertaining.
Yeah, we did a chest and back workout, kept it simple, but still pretty difficult. Let's see. Someone says, how do you know if you have a hypothyroidism?
You'll have symptoms, or it'll show up in blood work. So uncontrollable weight gain, feeling really fatigued, your hair falling out all over,
Mm-hmm.
things like that are some signs. But of course, get blood work done.
Yeah. Do we have a
If
title
my
for this?
mom has if my mom, oh, well, I didn't do it. If my mom has PCOS, will I definitely get it? That doesn't mean you will definitely get it, but sometimes it comes genetically. We're like predisposed to having it, and then environmental things will trigger it to turn on.
Mm-hmm.
Sometimes it's not genetic. Sometimes if you have diabetes in your family, it'll be genetic in terms of like insulin resistance will be passed down, and then it can manifest as PCOS.
Yeah. Yeah.
Yeah.
Someone said, "Thank you. I can't wait to join the sisterhood."
How exciting!
If you don't know, we have a new membership website called the Sisterhood, and it's all updated. Currently, like everybody's loving it. That's been joining in the last few days, but it's basically a membership website where you can discover your PCOS type, and then you can start to manage and lose weight with your PCOS following the steps that we have for you. Yeah, you go through these 5 stages of discovering your PCOS type, going gluten-free, going dairy-free, discovering your carb tolerance, and then learning how to work out. So you go through these 5 pillars, like these 5 chapters that we have outlined with a video series. And as you go through that, you're basically learning and applying those things that you learn. Yeah. And what you're also doing is you're gaining points in the membership website. So you get points, and then you can use those points to buy things like a meal prep kit or something along those lines.
It's fun because like you'll have objectives before moving to the next stage. So like once you're gluten free for a week, then you can move on to dairy free. When you check that box off, you get points, and then when you get enough points, you can get a whole kit of meal plans and stuff like that.
Yeah. And I see, how do I get the membership? So the membership right now, if you go to our Instagram, PCOS.weightloss Instagram, it's in the bio link. So if you go to the bio link, you'll be able to get into the membership. You get a 3-day free trial as well, so you can get to see how it is completely before making a decision.
And get access to our workouts, meal plans, gluten and dairy-free recipes, group coaching calls, private Facebook group.
A great thing that Tallene did was there's a whole recipe section where you can have a whole custom recipes for breakfast, dinner, lunch based on your carb tolerance, which you get to pick, and you can adjust it as you go.
I got some DMs yesterday because I was eating rice with the pork sausage soup that I made. Mm-hmm. If you saw, it's on the stories, and it's really good. It tastes so good. You have to try it. But some sisters were like, oh, how much rice do you have? You know, how much do you put on your plate and so on? And it's a great question. Rice is gluten-free, so I do eat it. It's a carb, of course, so you have to make sure that you're eating it in a PCOS-friendly way. So obviously it's paired with the pork sausage in that dish, and that's what helps slow down the absorption of carbs into my bloodstream because I've paired it with some healthy fat protein, you know, in that dish. Not just that, I know how much to put on my plate. So after a while, you're able to gauge this naturally. In the beginning, though, you really have to figure out your carb tolerance by being really mindful, writing down how you feel after a meal, writing down how much carbs you had in that meal and tracking it, maybe in an app like MyFitnessPal, for a week or 2 weeks, and slowly lowering it as needed. And then you'll get used to eating that portion size. And then once you're used to that, you'll start seeing great results, you'll feel better, and so on. So after doing that for so long, I'm pretty in tune with like my carb tolerance and how much I feel like eating and how much is too much. Yeah. So I put like maybe a spoonful on my plate. It was great.
Nice.
Oh, and then, so in the sisterhood, we discussed this in detail too. Sunak has edited some videos in a really cute way to like help it be more informative and fun while you're learning about your carb tolerance. And then once you know it, you can select, there are like 4 buttons, 4 different ranges of carb tolerance. You can select which one you are, and it'll show you all the recipes according to that carb tolerance.
Yeah. Yes. So on YouTube, Shivani says, I have hypothyroidism and PCOS. I just recently started following you guys and trying to change my way of life by incorporating gluten-free and dairy-free. Awesome, Shivani. Let us know how it goes. Remember to go one step at a time. You got to go slow and, you know, get into that life like one day at a time so you're not like in shock. So that's great. Let us know how you do. Daisy says, I love your podcast. You guys are amazing. Oh, thank you. Thank you. Somebody had asked, babe, why gluten and dairy free?
That's a great question.
So if you're new to our page, you've seen that we're a little bit different from other PCOS accounts. And one thing that we suggest that you can try to do is going gluten and dairy free. Of course, it's not that it's 100% for every single person. It's not like the cure-all, fix-all for every single woman with PCOS. But we found that in our experience, gluten and dairy free helps a lot of sisters with PCOS. Time, you can explain why.
Yeah. So with going gluten and dairy free, it's more of a diet approach, a lifestyle approach before doing anything else. And it's much more easy to adapt to rather than like restrictive things like keto and sometimes like really intense intermittent fasting and stuff like that. So it's a great first step for a lot of sisters. And so basically gluten can cause so much inflammation. And studies show that this protein called zonulin releases in your stomach when you have gluten. When you have gluten sensitivity, it causes the junctions of your stomach to like loosen up basically and then cause the gluten protein to get through and into your bloodstream, causing chronic inflammation. And so that's the root issue with PCOS in all sisters. Like we all have chronic inflammation that's causing, all the different types of PCOS to manifest. So basically when you have chronic inflammation, your cells are insulin resistant and they're basically not allowing the hormone insulin to give them sugar from your bloodstream to burn up for energy. And then what happens is that insulin triggers high testosterone, causing like all of these PCOS symptoms. And that sugar left in your bloodstream stores as fat and we gain weight uncontrollably. And not just that, it causes our stress hormones to go nuts because we have chronic inflammation all the time. So basically, gluten can have that effect on us. And when you reduce gluten, you're really helping your insulin levels and your stress hormones. And then some sisters see immediate results and some sisters see some people see immediate weight loss results and some people see immediate symptoms alleviating in the beginning and then weight loss afterwards. So if you feel good doing gluten-free, then you should definitely stick to it. And you'll only know if you do it for like 1 month consistently. And then for dairy, it triggers high insulin levels, among other things. Yeah. And for PCOS, that's awful because most of us are insulin resistant. And
dairy is very high on the insulin index.
Yeah.
Well, we got a lot of comments on YouTube. First time we're going live on YouTube, and I love the amount of people there, and they're asking a lot of questions. Sadiqa says, I love your constant updates and engagement with your community. It's Hiba says, oh my God, glad to catch you live. Been gluten dairy free for 10 days and my cravings have decreased immensely. Amazing. Love hearing that.
She got her insulin under control.
Yeah. And she said, oh my God, she said one of our TikToks is stuck in her head.
Which one?
The one with the laughing face and the monkey.
Oh, yeah.
She asked, I was wondering what you guys would recommend for hair loss. So, yeah,
my gosh, I've been meaning to post this. We had someone send us this amazing picture of her hair growing back after going gluten and dairy free. And it's because, she started managing her insulin resistance and inflammation. And it's amazing what an impact it can have on your hormones. And then as a result, all your symptoms like hair.
Yeah. Some questions on TikTok now. How could you start on your journey with PCOS weight loss and getting back your cycle? So some people are trying to see what's a good way to start my PCOS weight loss journey, or what is a good way to start with, getting back on my cycle, things like that.
A good place to start is just by slowly changing your diet. So that could just be swapping one meal out to be gluten-free. Just one bite at a time. It doesn't have to be an all or nothing type of thing because that's really hard to stick to and that's really hard to maintain and turn into a lifestyle. And we show you that in the sisterhood. Stage 2 is going gluten-free. Then stage 3 is dairy-free, but you only move to stage 3 when you're ready to do that.
Yeah, and it's very important to go slow because you don't want to shock your body into when you're trying to lose weight. You don't want to restrict yourself or make yourself feel like you're restricted. Because going gluten and dairy free, one of the great things about it that is not really a restrictive diet because you can still eat the things that you love. You just have to be a little bit more mindful if it has a gluten or dairy in it, and then from there it gets easier as you get used to it. And somebody asked, what is the best times to work out? Should I work out in the morning or in the afternoon? So like honestly, with this question, I see this question like when I talk about it with my friends too and stuff like that. Like to me, like it doesn't really matter if you're working out in the morning or in the afternoon because it doesn't really make too much of a difference in where your stress hormones are. I would actually suggest not working out late at night. So if it's like past 8 p.m., definitely don't work out then because when you work out, you know, your body gets into this energy level and the metabolism rises and then your stress hormones are a little bit higher. So let's say like a couple hours later when you want to sleep, it'll be actually harder to fall asleep because you worked out just recently. So I feel like as long as you work out by like 6 p.m., you should be fine. If you do it in the morning or in the afternoon, doesn't really matter. I would just suggest like don't like wake up in the morning starving and go work out because you don't want to work out on an empty stomach. That's going to affect your like your energy level throughout the workout, and your cortisol will spike, and it'll affect your insulin resistance if you're if you're starving during your workout.
Yeah, and our workouts are slow and they don't impact your stress hormones. So basically, it wouldn't matter at what time of day you did it because women with PCOS are really sensitive when it comes to stress hormones like cortisol that are released while you work out. And so when you're working out and you're doing something intense, by the time your cortisol comes back down, it takes so long to like relax and then go to sleep and so on. So if you're doing slow weighted workouts, you should be fine.
A couple quick questions. Are you guys doing the giveaway now? So we are doing a giveaway every single day of the month of PCOS Awareness Month. As most of you know, we do a giveaway every single week, but just for this month, we're going to do a giveaway every single day of the month. What are we giving away? During this whole month, we're going to give away 20 3-month supplies of Ovacital, 20 of them.
20!
3-month supplies of Ovacital, and we're going to give away 10 1-month free membership to the Sisterhood. So that's a total of 30 prizes. And to start off today, September 1st, we're going to give away 3 prizes today that we're going to announce the winner for at 5 p.m. So the 3 prizes that we're giving away today, one of them is a 3-month supply to Ovacital, and the other 2 are 2 copies to Dr. Jolene Brighton's book, Beyond the Pill, which is about birth control and post-birth control syndrome and other things like that. So 3 prizes today. We're going to give them away today at 5 p.m. Go to our post on Instagram to find the details of how to win. Tallene, there's a lot of questions about Ovacital. Why don't you explain it?
Sure.
I'm just like I'm the mediator. I come in and so, and I give the mic back. I know my place, ladies. I know my place.
So, Ovacital, I see a lot of questions about this. So again, check out the highlight called Ovacital where you can order it for 15% off with our PRC code. But basically, this is seriously the best supplement for PCOS if you have insulin resistance. I know the first line of approach for insulin resistance is typically metformin. And metformin is a pharmaceutical, and you can actually, it actually like competes with Ovacital or inositol in general because studies show that inositol works just as effectively as metformin. So if you're having like stomach pain and like horrible reaction to metformin, consider taking Ovacital. It's not a prescription. You don't have to nation in your body. So the 40-to-1 ratio of Mayo and D-chiroinositol is exactly what is actually in your body. That's why it works so effectively. And it causes your cells to be able to pick up that sugar in your bloodstream from the insulin hormone and burn it up for energy. And it'll assist in weight loss. So like if you're changing your diet and you're really managing insulin resistance, going gluten and dairy free, then that's like working for you. In combination with Ovacital, it's great because that will help you reverse your symptoms and lose weight with PCOS. You don't want to just take it and not change your diet because it's not going to reverse anything. Yeah. It's just going to mask the symptoms and stop it from progressing. But if you change your diet, you can reverse it, you can lose weight, and it can be great for you.
So if you've tried Ovacital and it's worked for you, comment below. Let us know how Ovacital was for you. We have like a whole highlight section on Instagram where you can see all the testimonials of sisters who've taken Ovacital. So
we have thousands. I didn't even post them all.
Yeah. So let us know if Ovacital worked for you. We'd love to have other sisters see your improvement with it. Can I have a cheat day in my gluten and dairy-free diet? Okay, one thing, we don't like calling it a cheat day because that puts a negative connotation to it. And two, absolutely. Like, this is not a restrictive diet, or it's not even a diet. We don't call it something like that. We call it a lifestyle change. It's really about consistency and not perfection. There is no such thing as perfection in this world when it comes to anybody's journey with PCOS. So you don't have to be perfect going gluten dairy free, nor do we say you have to be perfect. It's really about consistency. It's about making the lifestyle consistent and just sticking to it like that. Like if you have it once a week or however often, don't worry about it. Just just try to move to the next meal or to the next day without thinking too much about it.
Oh, I started Ovacital and it stopped my cravings. I take it every day and I've seen a difference in my weight.
Amazing.
Yeah, it helps with cravings instantly. Like you just pour it in your water.
Yeah.
It's this tasteless powder twice a day. Take one with breakfast, one with dinner, and literally your cravings are gone. And it helps with I've noticed it helps with like hunger and fullness cues with your hormones. So like you're not overly hungry all the time. Like it's just normal. Like your metabolism starts to work properly.
Yeah. And then on YouTube, someone asked, once you get off of Ovacital, will you put the weight back on even if you stay healthy?
No, it actually treats insulin resistance at the root of the issue. So once you've taken it for 3 months, or if you've taken it for 6 months, however long it takes you to reverse your insulin resistance, you can stop taking it and you'll probably be fine. You just have to maintain a healthy lifestyle and not eat a bunch of sugar and like reverse everything, and you'll be fine.
Yeah. Someone said, I tried it, or Hajidal says, I tried it and I finally got my period. Just to let you know, I never got my period naturally, but give it time. I saw results after 3 months. Very, very happy for you, Hajidal. And just to go off of what that sister said, so Ovacital comes in a 3 month supply. And the reason being is that it usually takes about 3 months to balance your hormones, your insulin resistance, and so forth. So like if you do get Ovacital, try to make sure you just take it the whole 3 months.
It typically takes within those 3 months to get your period to regulate. And if it doesn't, you take it for 6 months, it's fine.
Yeah, along with diet and lifestyle change.
Let's see. Can I overdose on it?
I'm not sure. I mean, just take the recommended amount.
Don't take more than it says.
Whatever the bottle or the bag says, take that amount. Don't get fancy.
Yeah.
On TikTok, there were some questions about a plant-based diet going vegan, and also about how many calories should we eat in a day. Do you want to tackle the calories first, babe? And I'll get the vegan part.
Such a good question about calories.
Yeah.
So with PCOS weight loss, it's not about calories. It's really about managing the root of the issue. So if you're insulin resistant and you have really bad cravings, like of course you're going to end up overeating, but that's not really why you're gaining weight. It's because you're insulin resistant and you're not able to metabolize what you're eating, and then your body thinks that you should be eating more. And also eating gluten can cause our leptin hormone to be less sensitive. So that leptin hormone is supposed to tell us if we need more food or if we don't need more food. And if it's less sensitive, then we end up overeating. And so gluten can cause leptin resistance and cause that effect. So basically, once you go gluten and dairy free, and if you take Ovacital because you're insulin resistant, you have cravings and your irregular periods, that combination will help you eat the right amount for your body. And you don't need to count calories and make sure that you're not eating 100 calories too many. Like that's not going to make the difference in terms of PCOS weight loss. It's more about healing your cell metabolism. And that's what we're doing by choosing foods that are less inflammatory, taking the right supplements, and changing your lifestyle so that you can burn up what you're eating and not have to obsess over calories and carbs and all of this.
Yeah. All right. And then on to the vegan question. That was a quick. I know that's a very popular question. Like, is vegan the best option for PCOS, or can I go plant-based? And honestly, one, it's totally up to you. Whichever diet you choose and whichever diet works for you, we want you to find whatever is right for you. But we have a couple things against the vegan diet that we don't think are good for PCOS. One being is that it's very difficult to have a high protein to carb ratio with a vegan plant-based diet. The reason being is that a majority of proteins that are available in plant-based, they're also high in carbs. So for example, like chickpeas, beans, what else is there?
Chickpeas, beans, quinoa is high in
Quinoa.
protein.
So like basically all the plant-based foods that are high in protein, they come with a pretty good serving of carbs. So you have to be very careful when you're on a vegan diet to make sure that you're still having a high protein to carb ratio and not forgetting that you're always having carbs with your meals when you're having protein. The other thing is also when you don't have the meat, the meat in your diet, you're also missing a lot of amino acids that are essential for repairing and recovering of your muscles. The same amino acids aren't available in a plant-based diet. So you're actually missing those nutrients and those things that are important. And a lot of like people who go plant-based, they get very fatigued, they get tired throughout the day because you're missing a lot of those essential B vitamins and amino acids and things like that you get only from meat or like from supplements, you know?
Yeah, but so if you've tried the vegan diet and you found that it hasn't helped you with PCOS, then consider, slowly adding some animal protein back in. And even like fish can be great for PCOS. It's really good for your adrenal glands and stress hormones, and like fish oil, things like that. It's so good for you.
Yeah. All right.
Speaking of fish, just the other day we made an Ahi Tuna Steak, and it was so delicious.
Oh yeah.
We got like raw Ahi tuna, and then you beat the egg whites.
Beat the shit out of it.
Brush the Ahi tuna with egg whites and season it with salt, pepper, and sesame seeds.
Yeah.
And then you sear each side for 30 seconds, and it's a 1-minute dinner. Literally, you just chop it up, put a little sauce over it.
Yeah.
Delicious.
So if you're looking for Ovacital, you can find it in our highlights section, and you can get 15% off using our code. And then can you take Ovacital if you're on birth control? Yes, that should be okay. We always say check with your doctor to be sure, but that should be okay. And then can I take Ovacital if I'm on metformin, and is metformin bad? So studies say that it's okay to take metformin and an inositol supplement together. However, we've seen through our personal experience that it can basically lower your blood sugar too much, so we don't recommend it. So it's up to you. Always best to consult your doctor when you're mixing medications, because we don't know your specific blood work and things like that. And if you're thinking about switching, please consult your doctor. Again, only he knows exactly what's going on with your body. But yeah, we have a whole like pros and cons of metformin on our podcast, A Sister and Her Mister. So if you go to, I think it's in like one of the first 20 episodes, you'll find PCOS and metformin, and we talk about the pros and cons and so that you can make an informed decision for yourself. And then we have an episode coming out next week, which will be all about insulin resistance. So definitely stay tuned for that.
That's right.
And then
these are the different.
go.
There's different types of PCOS. I know we're throwing these words out there, so let me explain. So there's inflammation, which most of us have, and you can have like a combination of these types.
What is inflammation, babe?
Inflammation's when you can't lose any weight, like it's just the scale's not moving no matter what you eat or don't eat. And your skin has cystic acne, or you have ovarian cysts, your hair is falling out, things like this. These are symptoms of a lot of inflammation. So if you're insulin resistant, the second type of PCOS, you probably have a lot of cravings and irregular periods, and like your hunger and fullness cues are off, so you feel like eating all the time. A lot of people have inflammation, insulin resistance combined.
By the way, when you have inflammation, it's literally like your body attacking itself. Like it's literally sending like cells to one area, like blood to one area, to fight whatever's going on in that area. So if you have like redness in some area, like acne or things like that,
like literally an intense workout will knock you out for 24 hours.
Yeah.
Or you can't sleep at night, but you want to sleep all day. Or you sleep all night and you still want to sleep all day. This is adrenal fatigue. And with this, you really want to make sure you're managing your stress hormones daily, and you're not doing intense workouts. CBD is a great supplement that we recommend for this. It can help you sleep better. It can help you relax, and so on. Going gluten and dairy free too, because that chronic inflammation from gluten and dairy is going to cause stress hormones to go nuts. Mm-hmm. So if that's causing inflammation in your body, then definitely adrenal fatigue can be an issue. Yeah. And then, so I had a combination of inflammation, insulin resistance, and adrenal fatigue. Then the fourth one is thyroid issues. So hypothyroidism. That's when your blood sugar is out of control for so long and it starts attacking your thyroid because there's just so much sugar in your bloodstream all the time. It's not being burned up. And then that can cause hypothyroidism. Hashimoto's is an autoimmune disease that like a lot of people with PCOS have. So a lot of doctors that specialize in thyroid health recommend gluten and dairy free as well because mm-hmm. that'll help with insulin resistance and inflammation, all of the other underlying issues that can trigger hypothyroidism. So you can have all four, you can have one, but the thing is if you don't manage your type of PCOS, it'll snowball out of control and turn into other types. And in stage 1 of the sisterhood, you'll learn what your PCOS type is in like a very informative and fun way so that you can manage it effectively. And there's a lifestyle checklist for each type of PCOS that you can go through and make sure that you're making the right lifestyle changes for your PCOS type. Yeah. And then once you complete that, then you can move on to going gluten-free in stage 2. Because you don't want to like jump into that without getting the other components down. Because in order to effectively lose weight with PCOS, you have to combine a bunch of, sometimes you have to layer in other components to help other than going gluten and dairy free.
Yeah. Did you mention you could have multiple types, babe?
Yeah.
Okay, great. Just because there's a question about that, I just wanted to make sure it was answered. Great question from YouTube, Devasmita, love your name. She says, hi, I have hypothyroidism and PCOS. I'm currently on metformin birth control pills. I want to stop taking the birth control pills. Is it okay? So now, we won't say if it's okay or not because it's totally up to you and it's up to how your body is, but we have a perfect resource for you. Yesterday, we released a podcast episode with Dr. Jolene Brighton. I'm sure many of you know her, but she's a very, very prominent leader in women's health, and especially when it comes to birth control and post-birth control syndrome. So I highly implore you to go ahead and listen to the podcast, A Sister and Her Mister. For this week's episode, we talk specifically about 1, should you go on birth control? What are the pros and cons of birth control? 3, if you're on birth control, should you stay on it? 4, if you're on birth control, what can you do to maintain a diet and lifestyle approach? And so much more. And then even in the podcast description, you'll go ahead and you'll see we have links that Dr. Jolene Brighton herself has provided, very nicely of her, has provided for you to access specifically with with both birth control. So you can find like diets that will help you with birth control and more. So check out the podcast. And honestly, if you have any questions about birth control, it is the best episode for it.
She's seriously the guru.
Okay. Yeah. And that's why we're giving away 2 copies of her book today, 2 copies of Beyond the Pill we're going to give away today, along with a 3-month supply of Ovacital. So if you just joined us in the last 5-10 minutes, we're doing a giveaway every single day of September, PCOS Awareness Month. And to start it off, today we're going to have 3 prizes. 2 copies of Beyond the Pill and 3-month supply of Ovacital. We'll announce the 3 winners at 5 p.m. today. Oh, a lot of questions about coffee.
All you have to do is comment on our post and tag a sister or a friend or a supportive partner.
On Instagram.
And tell them how we've helped you. Yeah, on Instagram.
We have to mention Instagram because we're live on 4 different platforms right now. We're on Instagram, we're on TikTok, we're on Facebook, and we're on YouTube. And I gotta say, YouTube is pretty freaking cool, man. So active and a lot of people there already. I love it.
Someone's asking about so many people. Yeah. So here's the thing. So like I mentioned, adrenal fatigue as a PCOS type. So coffee can really cause you to feel anxious and your cortisol to go up and not come back down quick enough, and then it can affect your sleep. And basically it's because the hormone cortisol is supposed to be high in the morning and low at night, and it's not. And it's low in the morning and you're tired, and it's high at night and you're awake. So in order to help that cortisol hormone coffee is going to make it worse. You want to have decaf green tea, things like that to reduce your stress hormones and help fight that adrenal fatigue so you can sleep better and have more energy. Like we shouldn't have to have coffee in order to function.
Yeah.
Like we should just naturally have energy. We should naturally be able to metabolize our food and not gain weight uncontrollably. And that's where we want to get you at so that you can just thrive with PCOS and not even know that you have it.
Yeah. And you can definitely go for decaf coffee because like Ty mentioned, like you shouldn't really need to have coffee to go through your day because you weren't born with it in your system, right? So what you want to do is like probably you're addicted to the taste and to the feeling of drinking coffee in the morning. It's not like the first thing we all think of in the morning. We get up and we're like, oh, let's have a cup of coffee and just chill out, right? But honestly, it's just like a addiction that we all have. It's a habit. And all you have to do is just try cutting it out slowly. Go for decaf. Just being careful because decaf coffee has about like 5 milligrams of caffeine still in it. Very low, but if you have too much of it, it may still impact you. So just be careful about that. Yeah.
I read something about reversing PCOS. You can reverse PCOS. You can live completely symptom-free and be totally fine and just thrive and like not even know that you have PCOS. You just have to figure out what type of PCOS you have and what type of lifestyle and diet changes work for your body. And this takes a bit of investigation. And of course, we're here to help you. And that's why we created the Sisterhood, link in bio, to help you with understanding what to do with your lifestyle so you can thrive with PCOS and just reverse it, live symptom-free, and be done with it. Because I have, and lots of my patients have. All of my ovarian cysts are gone, never came back. Like everything can be reversed.
Yes. And some questions coming from TikTok about, someone said your man is so supportive and it's beautiful. Oh, thank you. And someone asked, what works best for lowering testosterone levels? And then we'll go on to some workout questions after that. So lowering testosterone, babe.
So someone says Ovacital is amazing. If you're thinking about it, take it.
Yes,
take it.
Yeah. If you think about it for your insulin resistance, it's a great natural option.
It's also great for testosterone because when you're managing insulin resistance, you're also managing your high testosterone. So basically, if you're insulin resistant, that insulin is left floating around in your bloodstream because it can't do its job of giving your cells the sugar in your bloodstream to burn up. So it's floating around and then it goes to your ovaries and then it triggers high testosterone in your ovaries and then ovarian cysts happen and then irregular periods happen and facial hair and acne and all of these things. So that's one way to have high testosterone, and that's one of the more common ways. So it's great if you can just reverse your insulin resistance. That'll help your testosterone too.
Someone said, I forgot to take mine for the morning, and your live reminded me. Maybe we should do a live every single morning and remind everybody. All right, Ovacital tea time.
We should.
And also, there was a question about lowering hair growth in the face. So related to testosterone, when you have insulin resistance, this can lead to hirsutism, which is elevated levels of male hormones like testosterone, as Tanya was mentioning, which can lead to hair growth and hair loss. So if you're experiencing these, then it can be tied to if you have insulin resistance, it can be tied to that. So going and looking at your insulin resistance can be very beneficial, but you also have to remember to be patient because it's not like a one-day fix or like a couple days, Like unfortunately, like what happened didn't happen in one day. So to reverse it, it's going to be the same way. So it's going to take about 6 to 12 months of diet and lifestyle change. So just be patient. And if you find something that works for you, just go slow and keep on doing it.
Effect as testosterone on your skin health, your hair health, and so on, your period and so on. Yeah. Because your stress hormones will affect your blood sugar. So basically for that hair growth, not only do you want to change your diet and lifestyle, wait like 6 to 12 months. It takes that long for it to fully affect your hair, especially. And you have to be consistent. And then you can also do laser to treat whatever's already there. So if you change your diet at the same time as laser, that hair won't come back or it'll be less likely to come back. So it's like a full-on, thing that you have to approach from every angle.
Yeah. All right.
Someone's talking about pregnancy. You can definitely get pregnant with PCOS.
Yeah.
I mean, I hear some like terrible things from doctors about like you should get pregnant now, now that you're 21, because your eggs will be whatever by the time you're 30. It's like, I don't think it's true at all. I've reversed my symptoms and everything. And in fact, I went to the gynecologist and she said I was as fertile as a salmon swimming upstream.
And didn't they tell you the opposite when you first went?
Yeah, when I first went and I had cysts all over my ovaries, they were like, oh no, like, you're going to have all these problems. Yeah. But you can reverse it all and you'll be fine.
Yeah. And also, like, if you go to the doctor and you say you have PCOS, you want to do something, if the doctor tells you, oh, it's okay, if you're not trying to get pregnant, if you're not trying to get pregnant, don't worry about it. No, don't listen to that kind of stuff. You don't want to try. You don't want to try to fix your PCOS at a later time when you're trying to get pregnant.
It just gets worse.
Gets worse. You want to start now when you have time, basically, until you want to get pregnant, and like you don't want to wait until that moment.
A lot of sisters are saying, I got pregnant. And that's great because, also a lot of women with PCOS don't have fertility problems at all, so everyone's different.
That's exactly what I'm talking about, Like, don't listen to that. If the doctor tells you that, tell him to screw off and go find another better doctor. And Ali Girl says, I have a baby and I have PCOS. So there you go. There's an example right there. And there's thousands, millions of people with PCOS and babies. So don't stress about it. Just focus on your PCOS and reversing it.
Relax, everyone.
Exactly.
Someone once said, like, oh, I guess the treatment for PCOS is to like sit back and relax or something.
Kind of. Yeah, kind of.
Like, stop working out so hard. Stop cutting all your calories. Calm down. Yeah. Just take care of yourself. Do all the nice things that make you feel good. Yeah. And we'll guide you every step of the way.
Mm-hmm. So there was a question about HIIT. Someone asked should I do HIIT workouts? And if you don't know what HIIT workouts are, they are high intensity interval training workouts. And basically what you do in a HIIT workout is you move from one exercise to another without rest. And we don't really suggest doing HIIT workouts because one thing to hormonal imbalance, and it's a little bit harder to bring back down those stress hormones. So excuse me for saying, but like for like someone like me, for example, like without PCOS, obviously I don't have PCOS, but when I work out and I'm going intense, what my body does is it releases stress hormones like cortisol because my body thinks that I'm in some sort of like a fight or flight mode. So it's like spiking the stress hormones so that I perform better. This is also known as an adrenaline rush, right? This is like what happens to like marathon runners and people who do 5K. They get these like adrenaline rushes like through middle of the race that helps them finish, right? So while this is a useful thing that our body does, like naturally as a reflex, it can also work against us. So if you have PCOS and you have hormonal imbalances, when your stress hormones get spiked, your cortisol levels are higher, your body is not able to lower them back down as quickly. So what happens is they stay elevated for maybe a day, maybe 2 days, sometimes longer. And what happens is you wake up the next day, you have like almost like heart palpitations or you're feeling anxious, your body is completely tired, you're fatigued, and also it can impact your insulin resistance. You can have like these crazy cravings and things like that. And your body is also in a state of stress and state of inflammation. Your body thinks that there's something happening. So it's like causing all these inflammation signals. So with all this happening, bless you, my child. With all this happening, hold on.
Oh my God.
Okay. With all this happening, your body through inflammation and all these things is not able to lose weight, and the opposite happens. So what you want to do is focus on keeping the stress hormones low. And one way to do this, a method that we've created is called slow weighted workout approach, which you're basically doing like weight training, but we're combining that with light weights and going slow. So it doesn't mean we're going slow motion or anything like that. And come back down slowly, 5 seconds. Again, normal speed, slowly 5 seconds. So doing this instead of doing this, like, right? When you're going slow, you're actually engaging the muscles a lot more. So but we're still keeping the stress hormones down, but we're still engaging the muscles a lot more than we would have in a normal workout. So even though the stress hormones aren't spiked, we're still getting a great workout. So this is like a one quick example of like how to do a slow way to workout, but you can apply this approach to basically all workouts like squats and all that jazz. And
it'll make them so much more effective.
Yeah, it'll make them so much more effective. And in the sisterhood, we kind of explain the whole process of how to do slow way to workouts and how to start working out at home and all this stuff. So if you're looking for a place where you can learn step by step with the video tutorials, then the sisterhood is perfect for you, because we just go through first day how to start, and we answer all your questions. Like, should you take a pre-workout? What should you eat before and after? Should you blah, blah, blah. Like every question that you have, we answer it. And I mean, if you want to ask your questions, feel free to ask. We'll answer it here too, but we cover everything in the sisterhood too.
Someone just messaged asking if Ovacital helps with stress management because she feels like she's managing her stress better. And honestly, yes, like it helps you with your anxiety as well. I've read that they give inositol for people with anxiety disorders in higher doses. Of course, I'm not saying take a higher dose, but inositol can certainly help with this. And I do feel like so much more relaxed and lovely.
So lucky I have a very supportive hubby. Thank you. Guys, should I stop cycling? I love that, but is it too intense for PCOS? So one, if you're doing any type of workout, gauge how you're feeling afterwards. Like one, are you seeing results? If you're seeing results, then more than likely you can continue and you should continue. But two, if you're not seeing results and you're just like stuck at a weight plateau, or maybe you're not feeling good. Maybe the next day you're feeling fatigued. You're not feeling like yourself. You're not feeling like you want to work out. Then maybe it's time to change. So even with cycling and things like that, and you can still jog, by the way. You just want to go at a steady pace, almost like you're in a car and you're going on cruise control. So you want to jog at a steady pace, and then by doing that, you'll be able to keep your heart rate and your breathing at a very normal pace, and it can never go out of hand. Like you want to avoid that. You want to go at a steady pace, and it's very powerful because once you control your breathing and your heart rate, you realize how much mental control you have over your body. So it's really good mental exercise too.
The Ovacital is linked in the highlight called Ovacital, and you can use the 15% off code in the PRC box, not the discount code box, the PRC box.
Yeah. And then somebody mentioned, where is the sisterhood link? So if you're watching on TikTok or on YouTube or anywhere else, it's in the Instagram bio link. If you want to join the new sisterhood with everything we talked about, you go to the Instagram bio link and you can enroll there. You get 3 days free. So you can check it out for 3 days. If you don't like it, you're more than welcome to leave. But we really think you're going to love it. So
yeah,
check it out.
It's so fun. Somebody said that she feels like she doesn't have a support system with going gluten and dairy free or PCOS in general. And we created the sisterhood for people to feel supported and feel like there are others out there who are managing it and who are giving helpful tips. And we're there giving helpful tips like in the private Facebook chat forum. So you feel support, share recipes and things like that. So you feel like you're not the only one going gluten free.
Absolutely.
So even if your family's not supportive or your roommates or wherever you live,
it comes with a full, you have a whole Facebook private group, as Ty mentioned, where you can basically talk with each other and post pictures of what you're eating or ask questions where me and Ty will always answer you. So it's a big community where we're all trying to support each other through everything. All right, I think we're all right. A couple things. So if you just joined us or if you're new, we're doing a giveaway every single day of the month. So it's PCOS Awareness Month. If you don't know, this is the month for PCOS awareness. Try to spread it. Try to talk to your friends. Try to talk to anybody you know about PCOS awareness. Try to spread what it's about. Don't feel shy. If you don't know how to explain it, feel free to link our podcast or our Instagram and they can find out there. But just try to spread PCOS awareness in this month. And to celebrate with you, we're doing a giveaway every single day of the month. So starting today, we're doing 3 prizes to start off the month. Today, we're gonna give away 2 copies of Beyond the Pill by Dr. Jolene Brighton, and then we're gonna give away 3 months supply of Ovacital. So that's today. It will be announced at 5 p.m. Pacific Standard Time. And if you want to enroll to win, you have to be on our Instagram and following our posts and stories, because on there we have all the details of how to win and things like that.
Yay, someone says there should be a site for a supportive husband. We'll try to make a Tinder for sisters.
Yeah.
All supportive, gluten and dairy free.
Yeah.
Only.
Yeah, we should. All right, sisters.
All right, sisters.
We're gonna go. So don't forget the giveaways every day of the month. Please participate because we want to give them away to everybody who wants a piece, basically.
Yay.
Yeah. Alrighty.
All right, sisters. Talk to you later.
Later.
Bye.
Okay. All right. All right. Thank you, YouTube. We appreciate you. It's the first time going live, and we'll definitely do this again every time we go live.
Bye.
And this.